Billions of dollars spent by the state in response to COVID-19.
The KVUE Defenders followed the money to see what the state bought with your tax dollars. Here's investigative reporter Brad Stryker.
Normally, before the government signs a contract to buy goods or services, it publicly solicits bids from companies for their best offers. That bidding process is to help make sure that your tax dollars are well spent. But we found out during the pandemic, the state of Texas spent billions of your tax dollars without any competitive bidding.
When you're in a rush, when there's an emergency, there's a case sometimes for doing it. But it's not the kind of ordinary practice that any government ought to engage in.
Don Kettle is a professor at UT Austin's LBJ School of Public Affairs. He's concerned because under Governor Greg Abbott's disaster declaration, the state made purchases without getting bids in an effort to get supplies faster.
The risk of not going out for bid means that you might pay too much money, and may mean that you get substandard equipment, and may mean that you don't get it when you need it. And in short, the taxpayers don't get the money's worth.
The KVUE Defenders obtained data showing contracts paid by the Department of State Health Services without getting bids or by using emergency spending. We found 529 contracts, a total of about $4.4 billion spent between March 2020 and February 2021.
On the one hand, it's not surprising given the fact that there was an emergency. On the other hand, that's a lot of money.
According to DSHS data, the biggest contract went to BCFS System, a nonprofit based in San Antonio, for staffing services, a $3.5 billion deal. A spokesperson for DSHS said that payment was for thousands of medical professionals deployed to work in hospitals and nursing homes across the state. We also found $716 million to Angel Staffing, another San Antonio-based company, and we discovered nearly $30 million in contracts for facilities for COVID surge capacity in the Houston area. The DSHS spokesperson said those facilities also had beds for COVID-19 patients ready to be discharged from the hospital, but still needing a lower level of medical care.
We need to pay a very careful look at the overall quality of what we're getting and how much we're spending. That's a basic question that taxpayers deserve to have answered.
Kettle told us while he understands the need for avoiding bids during a pandemic, it's important to understand the risks of spending without a bidding process.
One of the reasons why we make sure we have bids is to make sure that money doesn't flow to people who are politically wired, that the money is not spent in big ways on people who are major campaign contributors, who have political connections somewhere.
And Kettle said other than making sure taxpayers aren't falling victim to poor spending habits, officials need to consider what might warrant the need for spending without competitive bidding in the future.
We are going to have other public health emergencies, and we need to make sure that when the next time comes, as it surely will, we're prepared to do even better for taxpayers and better for citizens the next time.
So far, we haven't found any evidence of political ties to any of these contracts, but we'll keep looking. And a spokesperson from DSHS told us that all of these COVID-19 expenditures have been or will be funded by federal funds. That's still taxpayer money, but the burden falls less heavily on Texans directly. In Austin, for the KVUE Defenders, I'm Brad Stryker.
Brad, thank you for that. Now, if you got something you'd like the KVUE Defenders to investigate, send us a text message to the number you see on your screen. That's 512-459-9442.